Hi dear doctors, welcome to the class of 𝗧𝗲𝗹𝗵. Myself Dr. 𝗲𝗵𝗺 and we are discussing about the pediatrics class. Let's now understand about the very important examination, that is the examination of skin. So if I talk for the physiological changes in the skin, first of all we'll talk about the erythema that is self-resolvable in 5 to 7 days. So you remember 5 and the fifth letter in the alphabets is actually E. So from E you can remember erythema toxicum neonatorum. Okay, erythema toxicum neonatorum. Coming on to the next part, that is called as transient neonatal pustular melanosis. So there will be pustules which will be formed, but they are transient. So transient neonatal pustular melanosis. Coming on to bronze baby syndrome. Now what is bronze baby syndrome? See what happens whenever you are going to give phototherapy and the child is having increase in conjugated bilirubin. Please understand, if the child is having conjugated bilirubin already and if you are giving phototherapy to these patients, the child is going to develop grey brown discoloration. Okay, the child is going to develop a grey brown discoloration after the initiation of phototherapy, which of course resolves within several weeks after discontinuation of that. Then you have got some change which is called as Harlequin change. Okay, you have got some change which is called as Harlequin change. So Harlequin color change. Actually, if the infant is lying on his side, okay, if the infant is lying on the one side, it causes the reddening on the dependent part and blanching on the, so it causes reddening of the part where the child is lying and blanching of the part where the child is not dependent. Okay, so it is entirely benign condition and lasts for seconds to minutes, just for a smaller period of time. Then most common pigmented lesion in the newborn, which is actually blue-grey color of macules which are there on the sacral or the gluteal region on the shoulder. Sometimes it is called as spots, which we call it as Mongolian spots. It is called as what spots? It is called as Mongolian spots, which usually fades within a year. Then there is something which is because of accumulation of sweat beneath the eccrine sweat glands, which is obstructed by the keratin. So if this is a sweat gland tube, so if it is obstructed by the keratin, there will be accumulation of the sweat and that leads to the milia. Okay, that leads to milia. So this is erythema toxicum neonatorum. This is bronze baby syndrome which is going to be there due to blanching. And then you have got this is nothing but the Mongolian spot which is going to be there. Then after that we have got this. So these are now pathological skin manifestations. There is a syndrome which is called as 𝗧𝗲𝗹𝗵 syndrome. This 𝗧𝗲𝗹𝗵 syndrome is actually a condition where there is a vascular malformation. Okay, so you know the capillaries over the face are not properly formed, and since these capillaries are not properly formed, they leads to the formation of stains. Okay, these stains are called as port wine stain because the color is just like port wine, so port wine stains. Okay, sometimes we have seen that these 𝗧𝗲𝗹𝗵 syndromes are associated with neurological abnormalities like seizures as well as hemiparesis. So it's a good idea to do MRI to check for the CNS abnormalities. Next pathological condition is nevus simplex. Now what do you mean by nevus simplex? So basically it's just like a stroke bite kind of thing. Okay, can you see this is just a stroke bite kind of a thing which can happen as a single red patch or multiple red patches like this. This is called as nevus simplex. Then you have got something which is called as nevus sebaceous of Judson. So what is nevus sebaceous of Judson? That is the yellow tan color of nevus that is going to happen. Now the important thing is that you have to do surgical excision because it has got a higher risk of malignancy. Then you have got seborrheic dermatitis. So dermatitis means inflammation of the skin. Okay, so inflammation of the skin, but it is going to occur where there is a lot of sebum which is there. So where there is a lot of sebum. So I've seen a lot of people who are saying my scalp is very oily, right? So sebum gets accumulated inside the hair, and that leads to inflammation of the skin, which is actually characterized by the greasy scales, by the erythema, and it occurs most commonly, as I have told you, in the scalp region. So this was all about the clinical examinations of the skin of the neonate, and thank you so much for watching. We'll see you in the next class.